Good morning. My name is Richard Wexler, and this is Caring in America, the podcast for caregivers and care recipients. As I do on every episode, a little recap of who I am and why I'm doing this. So go back about 18 years, minding my own business in the software industry. My wife and I married later, 2 small children, one 11, one 7. The summer of 05, we start getting 4 phone calls. All 4 of our parents, both of hers, both of mine, are extremely ill. And all of a sudden, our life takes an amazing change as we start an adventure of taking care of the 4 of them for 14 years. That led to the formation of my company, Points of Life. Learned everything I possibly could about this small word called care. Started educating people around the country. Fortunate to educate a lot. Then about a year ago, said to myself, how can I possibly reach out to more? Started looking into a podcast, launched it in 2023, and here we are. So in today's episode, we have a special guest. I'm about to introduce him. His name is Robert Vande. He is the Executive Director of the IHCA, which stands for the Idaho Health Care Association, and he started in that position just a couple of years ago, in January of 2001. He has an MBA from the University of Utah, a BS in psychology, and a Gerontology Certificate also from the University of Utah. He was an administrator of a skilled nursing facility in Eastern Idaho for 4 years, where he served on the board of directors of IHCA. Robert also worked in assisted living for 3 years. Good morning, Robert. Are you there, sir?
Hi, Richard. Here. Thanks for what you do.
Everything's well here. I hope you had a safe and happy New Year.
Wonderful. Good times with family. Thank you. I hope you too.
Yeah, very much so. So what I'd like to do is kind of start with a general question. What is the Idaho Health Care Association?
You know, that answer has changed over the decades. Probably 70 years ago, we were the Nursing Facility Association. And then about 20 years ago, we added ICFs, which is Intermediate Care Facilities for the Intellectually Disabled. Okay. About 17 years ago, we added assisted living, as that really started to grow quite rapidly. And then 3 years ago, we added home health, hospice, and home care, non-medical home care agencies. So we're the association that represents, lobbies for, provides education to those facilities and agencies that care for Idaho's elderly and disabled.
Wow. So that's a huge amount of things that you're doing. You're obviously covering a lot of different areas. So if you can, for our audience, describe more specifically what your role is as the executive director.
You know, I was talking to a group of professionals in Idaho the other day, and one of them stopped and said, now, wait a minute. So are you a special interest group? And I said, yeah, we are. We represent a special focus industry, those who serve the elderly and disabled, and we provide education to them, best practices, and then we lobby for them in the Idaho Legislature as well as in the U.S. Congress, trying to help our policymakers understand what we need to provide better care. Sometimes that's more reimbursement, Medicaid or Medicare reimbursement. Sometimes that's more common sense rules that will actually lead to better care, not just more paperwork. The last 3 years, it's really focused on COVID education, as well as assistance to find caregivers and staff and nurses, as that's been the number one issue in addition to COVID, is the staffing crisis. So we've pivoted to really help our agencies and facilities find and retain more staff is one of the major goals that we have right now.
And I'm aware of that problem. It's a problem that affects whether it's home care, assisted living, memory care across the United States. Is that a severe problem here in Idaho? Do you feel like you're getting your hands around it? Where is that standing right now?
We have made a difference, and I have great satisfaction from that we've helped our facilities find and learn how to retain their staff. We haven't nearly helped solve the problem. Idaho is fast growing. Many people are moving to Idaho every month, but it's not the 20-year-old college students that are moving. The vast majority are retirees, maybe in their 50s. Sometimes they bring a parent along that needs care. So our need for caregivers has dramatically increased in the last 10 years. The supply of caregivers, of course, has not. And the demands on caregivers it has grown, but their demands on their own financial well-being has grown too. Rent has exploded in certain markets throughout Idaho, especially the Treasure Valley, which is Boise area, and Coeur d'Alene. The rent has probably doubled in the last 5 years. Their wages haven't doubled. Medicaid, Medicare reimbursement certainly hasn't doubled. So our poor caregivers are really between a rock and a hard place, and many just love what they do and don't want to leave, but it's becoming financially impossible for some caregivers to stay in our field. So we're doing everything we can to help subsidize, help find new training opportunities to make a difference, but it's an uphill climb for sure.
That's fantastic. I don't know, maybe my audience is smarter than I am, but I'm not sure if a lot of people really understand when we're talking about an assisted living, a building, we're talking about a memory care, a building, we're talking about companies in the in-home care space actually coming into someone's home. It is a business. And there, some of the in-home care are franchises, some are mom and pop. John and Mary, a couple in Boise, decides to build an in-home care company, but they're a business. And as you talked about, they have expenses. And I know there was an issue with this before COVID. My understanding, and you can correct me if I'm wrong, that issue has gotten worse after COVID. But as we have this huge population that I talk about all the time, about 80 million baby boomers moving north, which crazy, the oldest will be 80 in literally a couple of years, and we still have about 20 or 30 million of their parents still alive and still with us. And you probably see this more than I do, but we're seeing so many folks that are even over 100 years of age that are needing care. So obviously having the appropriate number of caregivers is extremely important.
Absolutely. And, every family, we'll probably get into this more, but every family really needs to have a discussion with their parents, with their children. What kind of care plan do we have in our family? Not only saving for retirement, but saving for your healthcare needs in retirement. And the general public doesn't understand the difference between assisted living and nursing facilities and home care, what Medicare pays for, what Medicare mostly doesn't pay for, and what your financial plan is to provide that care. It sounds like you were able to take care of all four parents, which is amazing. Not every American can do that, especially when both husband and wife have to work. It's just like the daycare challenge. There's a huge problem in America right now of having enough daycare for children. Well, that same, as you can imagine, that same problem exists for seniors and care for those who need assistance daily. And there's really not the same understanding. Everyone understands the child care and what they do, but the general public doesn't. Even policymakers and lawmakers sometimes don't understand the difference and what Medicare doesn't pay for, which is all of long-term care. They pay for short-term care, but long-term needs, Medicare doesn't pay for. And that's a stark realization for folks who find themselves in need of long-term care.
I thank you so much, Robert. And I wonder, have you been on the road with me for the last 15 years? Because I mean, what you've been talking about sounds exactly what I've been talking about. And I tell people, I bring up this 4-letter word that people hate called plan on every episode. And what you just talked about, all these components, it's so important, folks. Please, when you're listening to this, tell your friends, tell your neighbors, tell your other family members. You have older loved ones in your life. You really need, as Robert was saying, to have this type of conversation. What is care? You ask somebody, an older loved one, where do they want to live? As if something happens to them, they're probably going to say in the home. Does that make sense? Is the home set up properly? Is there stairs everywhere? Or might it make more sense to move to an assisted living if there are severe memory issues, potentially a memory care facility? But we need to talk about that, as Robert was saying, from families. And one of the biggest issues, this is not cheap. We've talked about that a lot on our prior episodes. Whether you're keeping someone in the home, moving to an assisted living, moving to a memory care facility, etc. So I know when Robert's speaking, obviously when I'm speaking as well, this is a huge thing that we want to talk about. As I kind of backtrack a little bit, Robert, you've seen so much change within the industry here in Idaho over the last 20 years in bringing in the actual physical buildings, assisted living, etc., and also home care. Can you talk about that a little bit, as you've seen that growth and as you've seen those changes?
Yeah, absolutely. Changes happen because of our demographic changes. The boomers have made it clear they don't want to be told you have to go to a nursing home. And so policymakers have changed rules and laws. When I started in this industry, and started my studying in the mid 80s, many states it was a nursing home or nothing. That's what Medicaid paid for. We'll pay for a skilled nursing facility. So you ended up with some patients or residents that really didn't need a nursing home, but they couldn't afford assisted living. And there were very few assisted livings then. And they couldn't afford to bring a caregiver in their home for 24 hours. And so when you run out of money, Medicaid's your only option. And Medicaid was only paying for a nursing facility. Almost every state, including Idaho, has changed their policies and really had Medicaid programs for assisted living, for home care, for adult daycare, for respite care, for all kinds of Medicaid benefits to actually help prevent the need for nursing facilities. And we're still the Nursing Home Association. We're also the Assisted Living Association. And we believe home is best. I agree with the boomers. If it's safe, government doesn't like to pay for care that's not safe. And so if it's safe, then great, stay at home. We will help you find agencies that'll make that happen. But, working families know that childcare is expensive, but that's generally 8 hours a day. Adult care is 24 hours a day. So it could be 3 times the cost of daycare. And that'll get your attention because daycare is incredibly expensive. It's almost cheaper to just stay home and take care of your kids rather than pay for daycare. There goes your whole salary. Well, imagine that times 3 for a grandparent or a parent.
Wow, this is a lot of great information, and let's take this to another step, and it may be not something you and I have talked about before, but when that family, so it's mom, dad, it's their children talking maybe about grandma's now in her 80s, they can see that she's changing. Maybe they just saw her over Christmas and they see that things are progressing in a difficult direction. and they haven't really had a family conversation that I talk about, but now they think and they know, and it really is time to have that conversation. Can you give some advice? What are some of the things, and you were just talking about that, they should be looking at? Do we keep grandma in her home? Yes, she lives here, maybe in Eastern Idaho, so she's not really close. That's where the family grew up. Or should that family think about moving her to an assisted living? And to throw a little more a wrench in this conversation, maybe another situation where it's a grandfather, but he lives here in the Treasure Valley where the rest of the family does, so he's closer. What are your thoughts on both those situations?
In general, families need to get involved and pay attention and really look at the situation, look at options before it's too late. And what I mean is, if someone is declining, they can't do the stairs by themselves, maybe they're falling, maybe they're not eating properly or getting enough hydration, not taking care of themselves, you really need to step in and do something. Because if you don't, all the other options are done except for nursing facility once they have a fall, a fractured hip, or have a stroke, or their dementia continues without any kind of intervention. There are interventions, there's medications, they're getting enough nutrition, hydration, and mental stimulation and staying active can really help delay the advances of dementia at times. Not all the time, but early on, it can really help. Once it's too late, nursing home's your only option. And some people promise their parents, I'll never put you in a nursing home. I would caution you against making that promise. That's impossible. And I'm on a committee with a state senator and lots of different care providers, the Nampa Police Department, and state legislators, just everyone seeing this problem that, 80% in my experience of dementia residents are just confused and don't understand, but they're happy. But 20% or some number around there are agitated, think that their spouse is an intruder and is hitting. And if you wait till that point, it might be difficult or impossible to find a caregiver or a facility. And so don't wait till it's too late. Once there's a hip fracture or dementia has proceeded to the point of agitation or violence, the poor wife calls the police every day because the husband is beating her up and he thinks she's an intruder. Well, the police aren't going to arrest him. An ER trip, and the ER says, well, he doesn't really need a hospitalization, so you need to find a care setting. And they start looking and realize we've waited too long. There is no one that's going to subject their caregivers, who you're trying to pay and retain, to that kind of abuse. And it's devastating for a family. What do you do? There's no good answer. So we're working on a law change to help have some possibilities. But really, the best answer is be proactive. Don't wait till it's too late.
Yeah. Wow, Robert, this is fantastic information, folks, when you're listening to this. And I know I kind of beat you guys up about this, but I tell people, when you do plan, and the earlier you plan, it will be easier. This is really difficult, whether you're dealing with one parent, one grandparent, one in-law, or multiples like I had. It's really tough. But if you do some planning, and do we want you to plan when someone's flat on their back in the hospital after breaking a hip? If you haven't done it, yes. But we sure would like you to plan, as Robert's talking about, way before that, to really understand what your options are. And as Robert was talking about, it can almost get too late. And then it's extremely difficult. And really understand, if you work with a financial planner, make sure you're having a conversation about cost. If you don't, then connect with someone like myself, Robert, or other people out there to really understand what care costs. And over the years, I've been talking about more than 10 different ways to pay for care, but it's knowledge, and that knowledge is really golden. We've talked about a lot of benefits here, Robert, but if you could kind of talk some more about the association and the corresponding benefits for the family caregiver and the care recipient.
Our association, our customer is the facilities, is the agencies. That's who we work to serve. But it's quite often that the general public will find out who we are and call us and say, hey, I'm looking for a good assisted living in this area, or I need care, I don't have Medicaid, what do we do? We're happy to field those calls. And I know the facilities, I know the agencies, I'm happy to recommend one that might fit your needs. I can recommend care planners in the community that their business is to help you answer those specific questions. Who takes Medicaid? What kind of services does each one provide? Which one's better to meet your needs? Which one can accept a wandering memory care patient? Which one can't? I know those around here and some throughout the state, but there are experts that that's their whole job, is you pay them a nominal fee to talk about planning almost when it's too late and your plans, it's really hard. What happens so often is the patient has fallen or had a stroke, is in the hospital, and Friday afternoon comes and the hospital administration and the doctor say, hey, it's Friday afternoon, it's time to be discharged. And they give you 2 hours notice. And they say, you need to find a facility, you need to be out of the hospital in 2 hours. Or that's probably an exaggeration, maybe 8 hours. Well, if you haven't done any planning, boy, that's an uphill climb. That's a crazy day. And you don't have time at that point to go tour 8 different facilities and choose the best one. No, who has an opening? Who will take this kind of patient? That's your choice. So if you don't do your homework before, your choices really shrink. In fact, if you have a disabled person in your family that you're providing care for, Medicaid will pay you to provide the care. If you do your homework and apply for a license called a certified family home, there are probably other licenses as well, where quite often an adult, an aging parent caring for an adult child with a developmental disability that they've cared for their whole lives, have to care for them the rest of their lives. They don't want to see that. Medicaid and policymakers don't want to see that adult go to a nursing home that doesn't need a 24-hour nurse. Great, they will pay the family. I've even known some adults who got that kind of license to care for their own mother in their own home. Medicaid will pay you to do that. Now, it's a hard job, and you have to be there 24/7 unless you pay for someone to do some respite care for you. But there are many options. But if you don't get the survey, they come to your home, they make sure it meets the standards. Those options take time. That can't be done in 4 hours. So anything's possible almost if you think about it in advance.
Folks, I'm going to say something. I'm going to be honest like Robert has. We're recording this first week of 2024. For all these years, Robert, for the 20 years he's been doing this, for the 18 years I've been doing this, folks, I get so many hands in my face. People understand they have older loved ones. They understand they're changing, but they really, really don't want to talk about this. I get it. It's not a fun subject. It can be depressing. But as Robert is laying out, and as I'm laying out, this is the year, 2024, for all of us to wake up. If someone is aging and someone's health is changing, it probably isn't going to get better. Those are tough words, but they're real. And if you're in your 40s, you have parents that are 60s or 70s. You need to have that conversation now. If you struggle having it, reach out to someone like me. There's a lot of people around the country that can help you have that conversation. But it's so important to really understand, as Robert was laying out, all the things that are possible and how you're going to help those loved ones if their health even gets worse. And really think about this. You may have, like I did, mom, dad, both in-laws, maybe grandparents, maybe a close aunt or uncle that you've been close to your whole life still alive. And then what happens, like in my case, when 4 of them all get sick at the same time? This is not meant as a downer. It's meant as real information that Robert's giving you, I'm giving you. And as I said, I hope that 2024 becomes a wake-up call for all of us. As we get ready to wrap up, Robert, what other awesome pieces of advice would you like to give people?
I think the general public does see it as a downer, but it's difficult. It's part of life. We're all going to age. You have declines as you age. Everyone knows it's coming. And so it shouldn't really be a downer or a surprise when it happens. And just as a positive ending note, as you're probably aware, research has really shown that you can slow the progression of dementia. When you see a parent or a loved one to tell the same stories over and over, or get lost driving, or any one of many signs of dementia, it's time to intervene. Proper nutrition, get the labs done. What kind of chemicals or nutrients or minerals are they short on? There's physicians and nutritionists that can really get involved, and then stay active mentally. Sitting on a chair watching Wheel of Fortune all day is not mentally stimulating. But if those that are younger and haven't progressed dramatically in dementia, if they stay physically active, get blood flowing, some of that blood's going to go to the brain, stay positively hydrated and good nutrition, good labs, check what medications might be making the person more confused, and then mentally active. Crossword puzzles, book groups, anything you can to stay physically and mentally active will more likely slow the growth of dementia. My whole career, we were told there's not a cure for dementia. It's a one-way street. And research is showing that's not true. We can slow the growth and in some cases reverse dementia, but not at the end of dementia. That is impossible. At the beginning of dementia, get involved. That's some real positive research that's happened in the last 5 years. And a book I've seen is even the end of dementia, or the end of Alzheimer's, which is even more incredible. If you take on the challenge early and be proactive, that's some really positive news that all of us should be aware of and then act on.
This is fantastic information, Robert. I so much thank you for joining us today. We're going to wrap up in a couple minutes, but folks, this is fantastic information that Robert is giving you. Please listen. Please make an action plan. Please. So maybe we'll leave it, instead of waking up, we'll leave it at the action plan. Please make an action plan in 2024. You really want to talk to family. You really want to talk to older loved ones. Folks, I'm about to give you an email. Reach out to me if you're an expert in the field, senior care, elder care. You'd like to share that expertise. If you have stories you'd like to share, please reach out to me. That email, eldered2023@gmail.com. Robert, is there a phone number, a website that you would like to give out?
Yeah, why don't they just call my office here at 208-343-9735. I don't know everything, but I know a lot of people who know a lot more than I do. So happy to help any way that I could. And thanks for what you're doing, Richard. Important message. And I'm really glad people like you are sharing their expertise and getting the conversations going.
Thank you, Robert. And with that, folks, as I say on every episode, until we talk again, have yourself an awesome day.